Good evening, and welcome to Boston Medical Center's 25th Anniversary Gala. I'm Jason McCourty.
And I'm Devin McCourty, the better twin. You might know us from BMC's Board of Trustees and Philanthropic Trust.
And from our podcast, Double Coverage with the McCourty twins.
And maybe from winning Super Bowls with the New England Patriots.
Yeah, probably that. One is just fine, too. We've had such a great time hosting BMC's galas in years past. Tonight's virtual gala is going to work a little differently, but we're still going to have some fun.
First, we appreciate you all for letting us into your homes tonight. We see you in there.
That's a beautiful couch, Robin.
I know there's no dress code, but sweatpants, Alistair, really?
This gala is well-timed with Saturday being Juneteenth, when we commemorate the end of slavery in America and honor the commitment it takes to make equity a reality.
On top of Saturday being Juneteenth, it's also World Sickle Cell Day. Many of you know how meaningful it is to us as well. We have a special announcement related to sickle cell disease coming up you will not want to miss.
We don't want to give anything away just yet, but we want to find a universal cure for sickle cell disease. This is the most common inherited blood disorder in the U.S. and one of the most common genetic diseases in the world. You can be a part of BMC sickle cell work by making a donation right now. You can click on the donate button on your screen or text in your pledge. Either way, you'll be making an incredible commitment to achieving equity in disease research and treatment.
That's right, J-Mac. Tonight, we hope you will watch, be inspired, and join us in creating something really special. And we mean that quite literally, as over the past couple of weeks, an incredible mural has been completed in the community, and you'll get to see the process unfold throughout the night. You're going to hear a series of commitments from BMC and from friends and partners in the Boston community to break down the walls standing in the way of a better, healthier, and more equitable future.
Before we get into the program, we have many people to thank for tonight. All of our extremely generous sponsors. Let's take a look at them now on our screen. Our amazing event co-chairs, Marianne Harrison, President and CEO of John Hancock, Dr. Reshma Kewal-Ramani, CEO and President of Vertex,
Fred Lowry, Senior Vice President of Thermo Fisher Scientific, and Ronald Hanley, Chairman and CEO of State Street. Your generosity has helped BMC raise millions to better the lives of its patients and strengthen the communities it cares for.
And all of our friends and donors here with us tonight. Thank you for your constant support and love of BMC. We also have many staff members watching. You're all champions for the way you've tackled the pandemic this past year. We are humbled by the work you all did to save so many lives.
So we have much to celebrate tonight, thanks to all of you. But first, let's look back at BMC's proud 25-year history. Let's go to the highlights. In 1996, Boston City Hospital, America's first municipal hospital, merges with Boston University Medical Center. This first merger of its kind in the country is smooth sailing, thanks to Mayor Menino and BMC's former CEO, Elaine Julian.
In 2001, BMC starts a food pantry at the hospital to prescribe food to patients, plus a teaching kitchen that uses a culturally sensitive approach to help patients learn to cook healthy meals using ingredients from the food pantry.
Jay, I cooked a pretty good meal there, trust me, because you gotta eat good to feel good. In 2006, BMC begins its violence intervention advocacy program to guide victims of community violence through recovery from physical and emotional trauma. Advocates work directly with patients to provide a number of support services, including pathways to education and job training programs. In 2008, BMC establishes the Center of Regenerative Medicine. Their dedicated team of investigators is advancing stem cell research for diseases commonly found in BMC's patients.
This research holds huge promise for sickle cell disease patients, Dev. We'll have much more to say about that a little later.
In 2010, BMC signs a healthcare MVP.
Boston Medical Center picks up well-known hospital exec Kate Walsh to take over for veteran Elaine Julian, and a new era at BMC begins. In 2011, the Shapiro Center opens at BMC. It's the first LEED certified building on campus, a giant step toward becoming a carbon neutral hospital, and offers a beautiful space for primary care and outpatient services to BMC's patients.
BMC is not done yet. In 2016, BMC starts Street Cred, a program that provides free tax services to families who receive pediatric care at BMC, ensuring they get the tax credits they deserve. They've already returned $5.3 million to 2,700 families. But want to know the coolest part?
What's that, Dev?
It was a patient's idea. BMC liked it, and 2 pediatric residents made it happen. 2017 was a big year. Eileen and John Grinkin made the single largest donation ever to BMC, and the Grinkin Center for Addiction is launched.
2017 brought us something else to buzz about, D-Matt.
Oh yeah? What's that?
Bees on top of BMC's rooftop farm. In addition to loads of honey from 2 beehives, the rooftop farm produces more than 5,000 pounds of fresh fruits and veggies a year for the hospital's cafeterias, food pantry, and inpatient trays.
Wow. BMC invested $6.5 million in affordable housing for the community in 2017 as well. BMC research finds that patients in stable housing are healthier, spend less time in the hospital, and have more opportunities to stay well and to thrive. And last but certainly not least, 2017 is the same year we first teamed up with BMC, partnering in the campaign to tackle sickle cell.
In 2019, BMC received an $89 million Healing Communities grant with the goal of reducing opioid overdose deaths by 40% in highly impacted Massachusetts communities. And in 2020, the BMC-led Boston Opportunity System Collaborative is awarded $5 million in funding from JP Morgan Chase to open pathways to better careers, housing, and home ownership for residents of Mattapan, Dorchester, and Roxbury, encouraging success, not just treating illness. It's a totally new way to think about healthcare.
What an incredible 25 years. From the very beginning, BMC has created an innovative program after innovative program to help patients through tough times. These programs have become a cornerstone of BMC's work, going well beyond the limits of conventional healthcare to improve the health of people who need it most.
Now, let's talk more about 2020, Dev. Last year was a year unlike any other for BMC and for all of us.
I think it's time we bring out the boss to help us talk about it.
Mommy's here?
Stop it. I'm talking about the boss of BMC, the one and only Kate Walsh, the president and CEO, and our friend. Kate, the floor is yours.
Good evening, Devin and Jason. Thank you so much for hosting our very special 25th Anniversary Gala and for being such great friends to all of us at Boston Medical Center. And thanks to the viewers here with us tonight. Your ongoing support has been absolutely vital, but especially so throughout the past year. I hope tonight's program will show you the impact we're making on the communities we serve. As the coronavirus pandemic gripped America and the world, Boston Medical Center was on the front lines of the response. Limited access to testing was our first major hurdle, so we developed a rapid COVID test in 1 week. It received emergency use authorization in 1 day. We knew people living in shelter systems would be at increased risk, so we transformed a vacant building on our campus into a COVID recuperation unit. We set up a mobile pediatric unit staffed by a physician and a nurse to make house calls for routine care and immunizations. And that led to Project REACH, which provides extra medical support and much-needed supplies to our pediatric patients and their families. As food insecurity intensified, our food pantry set up home deliveries and adapted their operations to ensure that we could continue to provide essential food to our patients and their families. When the state required us to restrict access to our campus, we shifted to a telehealth format so patients could continue to receive care, a model that's been further integrated into many of our clinics and departments. Of course, we couldn't have weathered this storm alone. Donated items arrived daily.
There was a massive outpouring of support for Boston Medical Center, and it was from everyone. The fact that our community recognized what we could and did deliver during COVID-19 was immensely meaningful to all of us.
To make it all work, BMC providers and staff pushed themselves to the limit. Nursing updates called Some Good News shared the latest information and boosted morale.
And congratulations to MedSurg, who has been in so many different areas and so many different parts of the hospital.
On December 14th, Boston Medical Center was the first hospital in Massachusetts to receive the COVID-19 vaccine.
I do my hair talk, check my nails. Baby, how you feeling?
But the vaccine's arrival was just the beginning.
Hello again, everyone.
We needed to spread the word, answer questions, and soothe anxieties about the vaccine. We partnered with community leaders to identify vaccination sites that our community could trust.
We are opening our COVID-19 vaccination clinic here at the church in partnership with Boston Medical Center.
Come out to Morningstar, receive the vaccine, and let us minister to you on many different levels.
The job BMC did, especially with the vaccine rollout, in creating partnerships, reaching out and finding people where they were and meeting them in a culturally appropriate way, really stood out, so thank you.
2020 was the hardest year in our hospital's history, but the most difficult times can also be the most empowering. The trust and connection to our community and the partnerships we have developed throughout the pandemic will better allow us to face our next challenges together. I'm joining you from Morningstar Baptist Church in Mattapan, where for generations Boston families have come to worship. This spring, people began coming here for another reason, to receive the COVID-19 vaccine. Back in February, Boston Medical Center and the Mattapan Community Health Center reached out to Bishop John Borders and the clergy of Morningstar with an idea. Let's work together, hand in hand, to open a community vaccination site at your church, giving people in the city of Boston access to the vaccine in a place of comfort and trust. To date, over 16,000 vaccines have been administered at Morningstar, and more than 150,000 across all of our community sites in Dorchester, Hyde Park, Rosendale, and the South End. This incredible achievement was made possible by the collaborative effort of so many people and teams at BMC, the powerful partnership of community health centers, churches, schools, and other organizations, the help of hundreds of volunteers, and the leadership and support of Governor Baker and the state. We're proud of our role in making Massachusetts a national leader in vaccinations. But beyond the statistics, I've had the privilege of witnessing the excitement, relief, and gratitude when people get their vaccine. Neighbors greeting each other after too long apart, grandparents overjoyed about soon being able to hug their grandkids, young adults vowing to be vaccine advocates for their extended family and friends. We're providing more than just medicine here. Being here in the community to meet our patients where they live, work, and spend time together has never been more crucial. During this incredibly difficult year, we've been so fortunate to work alongside our community, to listen to their concerns, and to build trust. The connections we've made and the resilience we've experienced during the COVID-19 pandemic have shown us how BMC can be a better partner with our community, better serve our community, and how we together can provide better care. How together we can build a bridge past today's challenge to incredible possibilities ahead. The extreme toll this pandemic had on our Black and brown neighbors highlighted inequities that have been with us for generations. Racism, bigotry, disinvestment in neighborhoods of color, systems designed to prevent all people from living healthy lives. We have the opportunity to make real change now, to reverse these inequities and improve health outcomes. That's why, tonight, we're asking you to join us, to help break down the walls that are preventing our patients from achieving their best health and their best lives. By listening to what our patients tell us they need, walking beside them on their path, we learn from them and can adapt our medical care, services, and programs to better serve them. Through investments in housing, access to healthy foods, and fair wage jobs, people will experience more financial security and the opportunity for better living situations. Neighborhoods will be revitalized, resulting in healthy, thriving communities. But to make lasting systemic change, it will take all of us working together: government, nonprofits, community leaders, and steadfast friends like you. partnerships with committed business leaders and passionate change makers like tonight's co-chairs, Fred, Marianne, Ron, and Reshma, are the building blocks to our efforts. Thank you for leading our event tonight and for being part of our journey forward. Together, I know we can break down walls to build a healthier, more equitable Boston. Thank you. To tell us how one of our most innovative partners is committed to breaking down walls, it's my pleasure to introduce Fred Lowry, BMC trustee and senior vice president at Thermo Fisher Scientific. Fred?
Hi, everyone. I'm Fred Lowry, senior vice president and president of customer channels at Thermo Fisher Scientific. I'm also a proud supporter and a trustee of Boston Medical Center. You know, if we've learned anything since the start of this pandemic, it's that we must come together to face our society's challenges with a common vision and very intentional goals. You know, here at Thermo Fisher Scientific, we've been at the heart of the global response to COVID-19. We've been working with government agencies and researchers to ensure priority access to our instrumentation, as well as safety supplies, COVID-19 test kits, and other products to address the pandemic. We've also been working with partners like BMC and listening to members of the community and taking actions to break down systemic racism. You know, when COVID-19 disproportionately impacted the Black and Brown communities in 2020, we initiated the JUST Project, partnering with historically Black colleges and universities so that students, faculty, and staff could return to campus safely. Ensuring equitable access to testing, vaccines, and care means partnership and collaboration and working toward innovative solutions together. None of us can do this work alone. Partnering with Boston Medical Center allows us to work hand in hand with the passionate, determined communities of Boston to advance equitable health care in the neighborhoods that need it the most. Together with BMC, we are committed to breaking down walls to achieve racial and social justice and bring transformative change to the health of our community.
Thank you for those inspiring words, Fred and Kate.
You heard Kate speak about how we need to work together to break down the walls that prevent our community from achieving their best health and their best lives.
In the next few minutes, you're going to see how BMC is working to break down walls like housing instability and food insecurity. Let's watch.
My name is Thea James. I'm Vice President of Mission and Associate Chief Medical Officer. I'm also an emergency medicine physician here at Boston Medical Center. I've been here for almost 30 years, and I've seen a lot. I've seen everything, it feels like. I've seen a lot in the community, I've seen a lot in the world, I've seen a lot here in our hospital, because our hospital is a window into the communities and the world. What goes on in the world, what goes on in the communities, winds up being reflected in what we see coming through our doors every single day. When we have connected our patients who have come into the emergency department many times and had hospitalizations many times because of perpetual unstable health, when we connect them with a community wellness advocate, that person's health begins to stabilize. Their admissions to the hospital, their emergency department visits go down significantly. When they engage with patients, we can actually move that patient from a place of not thriving, an unstable space, to a place of stability.
A lot of people don't realize that you can have everything, but you can lose everything because you never know. It can be taken from you like a breath. Talk to anybody on the streets. You can be living your best life and then within 24 hours, you're trying to figure out where you're gonna sleep. Is your child gonna be okay? Where's your next meal coming from? I think the biggest impact of the shelter life is that people don't understand the toll it can take on your child. Like, they can go into a depression. They'll completely shut down. They won't talk, they won't eat. And he was worried about me. He was stressed out just like I was about the shelter. As a parent, something like that makes you feel like you failed.
My name is Eunice Barros, and I'm a community health worker for the housing prescription team at BMC. And I support patients experiencing homeless and their search for stable housing. When I first met Amy, she was at the family shelter. She was very anxious, depressed. She was crying a lot, trying to raise her son in the shelter system and trying to manage her health as well, and just overwhelmed. BMC's hope is to build a better community, a healthier community, to where we're providing patients with the tools that they need to better manage their health, their overall health, their mental health. The housing prescription is a complex care management program, and we have a partnership with Boston Public Housing, which we have a more expedited pathways for housing our patients.
When I got my keys to this apartment, I thought it was all a dream. I didn't think it was true until I actually literally slept here. My emotions were all over the place. I was crying. It was overwhelming, exciting, and I also felt like I was safe. One of the best things of having a home is that my son feels more independent and responsible because he cooks now on his own. A lot of the stress, a lot of the anxiety is not there anymore like it used to be. It's still there, but it's very manageable, especially with my team behind me. I'm independent again. I can do for me, and I don't need to depend on anybody. It's changed me, but it's also changed my son. My team at BMC is my family. Even on my worst days, I'll stick with BMC.
Good evening. I'm Marianne Harrison, President and CEO of John Hancock. I am honored to be a co-chair for tonight's event, celebrating the work of Boston Medical Center. John Hancock shares BMC's vision to help build healthier, more equitable communities. We are a founding partner with the hospital in its bold vision to make Boston one of the world's healthiest urban populations by investing in the root causes of urban health issues. The events of 2020 made this vision that much more urgent. We recognized how deeply systemic racism divides Americans when it comes to both health and opportunity. As we move forward, we are committed to fostering understanding, inclusion, and allyship within our own walls, but also ensuring we're informed corporate citizens as we continue to give back to the community. John Hancock does this through our initiatives like MLK Scholars, which provides summer employment, financial literacy, and leadership development for 600 Boston youth annually. And through supporting proven community partners like BMC, whose innovative, holistic approach opens pathways to opportunity for patients and their families. As a financial institution, we understand that stability is the foundation on which success is built. BMC gives their patients a prescription for stability by helping them secure safe housing, healthy food, and career opportunities so they can not only live a healthier life, but reach their full potential. We have a lot of work to do together to combat the oppressive inequities that affect the lives of so many of our neighbors in Boston. I hope you will join me in supporting BMC's mission to break down the walls so all of our communities can thrive. Thank you.
Thank you, Marianne. Housing, healthy food, safety, stability, these fundamental necessities make all the difference for patients' health. You can join BMC in their efforts to ensure patients have what they need to live a healthy life full of possibility.
So please, right now, grab your wine glasses or whatever your drink of choice is, because I want you to feel good about this. But make a donation right now. You can text your pledge to the number on the screen or click the donate button.
Once people have that baseline of stability, BMC keeps helping them reach higher to achieve their full potential. Let's take a look at how BMC is breaking down the walls to reveal pathways towards economic mobility in communities where people haven't always had those opportunities to thrive.
BMC is changing the way we do healthcare. We're going outside our four walls into the community to find new ways to have an impact. The BOSS Collaborative, which is what we call it, is a perfect example of what it looks like to partner with entities outside of our four walls. It has two pillars that it is focusing on. It is focusing on housing, acquisition, and preservation, and it's also focusing on economic mobility. Imagine if all of these people had the opportunities to achieve at their highest level and contribute to the economy versus relying on it. The BOSS Collaborative is a perfect example of what BMC is doing for the future and for the community. BMC is breaking down walls to build a healthier, more equitable Boston.
I think economic mobility is critical to a community because it's the way that you build on your wealth, and it's the way that you can afford to buy things for your family or save money for the future, save money for your retirement, save money for your kids' college education. And if you're not able to do that, it just makes things a lot harder in the future. My name is Erica Cuevas, and I am the program manager for the BOSS Collaborative at Boston Medical Center. I've been at Boston Medical Center for 9 years, and I've always tried to advocate for myself in order to go up the ladder. And I was the office operations manager for cardiology, but at that point I was losing childcare. So I had to decide between taking care of my child or working. With this role, I was able to continue being in the workforce, and it gave me the flexibility that I needed to spend time with my kids. And that's what's so great about working with BMC, because they allowed me to stay in the workforce, to stay with them. Like, I told them what my problem was, and instead of just brushing me off, they really worked with me to try to find something that met my needs. Best part is that this job works on advocating for other families and other women that may be facing the same situation or other situations of the same sort where they have the choice of either staying at home or getting back into the workforce. I really love my job, not only because I'm giving back to the community, but also because I feel like I'm indirectly helping my family and my kids' future.
Good evening. My name is Ron O'Hanley, Chairman and CEO of State Street, and I'm thrilled to co-chair tonight's Boston Medical Center Gala. For over 150 years, BMC's commitment to a healthier, more equitable Boston has never wavered. Before BMC was what it is today, it was Boston City Hospital, established in 1864 as the first municipal hospital in the United States. Boston City Hospital was a meaningful accomplishment for both the city of Boston and for healthcare across the country. As a municipal institution, Boston City Hospital provided much-needed healthcare to the urban poor of Boston, which at that time was primarily made up of the large number of Irish immigrants coming to the city. As a child growing up, Boston City was a household name, and one I will always remember. My grandmother trained as a nurse there and is very proud of her affiliation. Today, BMC shares the same mission of providing exceptional care without exception to the underserved, with an overarching vision of health equity. As the COVID-19 pandemic propelled countless members of our community into both economic and health crisis, BMC and its staff rose to each compounding challenge, responding with bold, innovative solutions. The pandemic also cast a bright line on the deep and troublesome disparities existing in our neighborhoods and the direct correlation between those disparities and wellness. BMC research has demonstrated that good medical care is not enough to achieve good overall health. One's health is also a function of employment and housing. BMC research demonstrates that one cannot achieve good health without all three. Now is the time for all of us to work together to make lasting, transformative change. At State Street, we have long focused on education and workforce development. Today, we commit to be even more intentional in our efforts to combat systemic racism in education as a proven way to break down walls to economic mobility. It is clear our community faces complex problems. We each have a different role to play, but by coming together, we can have a greater impact. By generously supporting BMC in their work, I hope you will join me in breaking down walls that exist for our community and opening more education and career pathways to improve economic mobility. With collaboration and commitment, we can move toward a brighter future together. Thank you.
Thank you, Ron. There's another type of wall BMC is breaking down, J-Mac, one that means a lot to us.
That's right, Devin. Millions of people around the world suffer from debilitating diseases that have not received enough support in terms of investment and research. Here to tell us about her company's commitment to change that is Dr. Reshma Kewal-Ramani.
Good evening. My name is Reshma Kewal-Ramani, and I'm the Chief Executive Officer and President at Vertex Pharmaceuticals. At Vertex, our mission is to invest in scientific innovation to create transformative medicines for people living with serious diseases like cystic fibrosis, sickle cell disease, beta thalassemia, and severe kidney diseases. For far too long, conditions like sickle cell disease haven't seen the same level of investment or innovation that others have, and the need for better treatments and cures remains high. We share BMC's urgency and commitment to close the gap in research disparities. There is hope. For example, we're making significant progress in our clinical trials for gene editing for sickle cell disease and beta thalassemia. As a co-chair for tonight's gala, I'm delighted to celebrate the incredible milestones that BMC has accomplished over the past 25 years. As we look forward, we're so proud to partner with BMC and patient communities to ensure together we bring new medicines to people living with these devastating diseases, regardless of race, ethnicity, or socioeconomic status. Together, I believe we can break down walls to transform, if not cure, these diseases altogether. Thank you so much.
Thank you, Reshma, for working with BMC to break down the disparities in research.
A lack of funding for these diseases doesn't just hold us back from discovering life-saving cures. It also means not enough diverse, talented young doctors learn to specialize in treating them.
We want to tell you about one of those diseases, sickle cell disease, that's been neglected for far too long, and how we're working with BMC to change all of that.
This subject is very near and dear to our hearts. So for this next part, come with us as we get comfortable for a little chat.
Find a new spot in your living room, a new couch, and come with us.
Come on, let's go.
Just follow me, J-Mac. Relax for a little bit.
Hey, get comfortable.
So, what makes you feel so passionately about the fight against sickle cell disease?
Yeah, sickle cell disease runs in our family. We've had to deal with this ever since we were kids. I remember when we were about 5 years old going and getting blood drawn and not knowing what was going on, but just crying and, you know, being in the hospital, seeing our grandfather get his legs amputated from the knee down. And then ultimately our Aunt Winnie, her battle with sickle cell has inspired us. Our father passed away when we were young. He had the sickle cell trait, and she really became that bridge to our other side of our family. And just watching her struggles every day, and she would tell us about sickle cell, but ultimately she was just so tough. She would always tell us about her faith. She would just tell us that she knew she would have a great day someday, and ultimately she would go to heaven. But she lived a lot of her life doing some things that she really enjoyed, and she was just a big inspiration for us.
I think for me, that's our Aunt Winnie right there. And I think when I talk about her, the one word that always comes to mind is a fighter. You know, she battled through so much. At the age of, I think it was 10, she was told she wouldn't live to see 35. And I think when you're told that, it can be such a deterrent, and it can be so devastating at a young age, but she continued to fight. She, for a lot of her life, was able to travel. She worked most of her life. She lived a fulfilled life, and I think that's what's been so inspiring for us is we get a chance to tell her story, and that's what our sickle cell legacy kind of is about when we've got involved with it, is just making sure we can get her story told and that many people can draw inspiration from her.
What were her struggles with sickle cell disease?
Her struggles were like a lot of other people who have sickle cell disease, especially later in her life. A lot of trips to the hospital, sometimes some very simple symptoms of a head cold would lead her in the hospital for a long time. And then eventually sickle cell took her eyesight. She was on oxygen 24/7. So she lived a fulfilled life, like Jason mentioned, but you did see the effects of sickle cell. I remember visiting her in the hospital many times, and she never told you about any of the bad days or bad things she was going through, but she was one of those people that had to always make sure she was hydrated. She did all of those little things, but the crises and the frequent trips to the hospital happened a lot, especially later in her life.
Tell us a little bit about your work with Boston Medical Center. Why is it meaningful to you folks?
I think their slogan says it all, you know, exceptional care without exception. And I think at this time in our country, that's what it's all about, equality and making sure we're presenting and giving those in need everything that they need and that they require without exception for anyone, no matter where they are in their lives.
Yeah, and I would say that too. I think, you know, when we first started working with BMC, they had told me all the things that they do for sickle cell, how many patients they treat, and how they really wanted to make this a focus. And now you fast forward a few years, and to see all of that actually coming true, I think it speaks volumes just about BMC's integrity. And, you know, whatever they say they're going to do, they do it. And I think that's been great. And having a Tackle Sickle Cell campaign here has been awesome. We've been able to really impact a lot of lives.
Why is BMC's work with sickle cell disease so important to support?
I think supporting sickle cell disease with BMC, you get to be kind of on that cutting edge room floor, like one of the first. You get to be a part of history and changing people's lives. You know, obviously, there's so many things out there that you can get involved in and donate time and money and really be a part of it. But I look at sickle cell as kind of being that underdog. You know, it's a devastating disease that doesn't get much attention or funding. And so I would tell you, just take that jump, take that leap of faith and join in.
Yeah, and I would say BMC's boots on the ground. I mean, every time something's going on in our country, they're doing something to impact those in their communities. When the pandemic started, I remember getting on a phone call and they're finding out ways to get iPads to do virtual visits. They're just always trying to come out with a way to make life better for their patients.
So what's your long-term goal with this work?
It's a great question. And speaking of that, we have some very exciting news. So I really need all you guys, come with us. We're going to go back over here. We're going to break some news to you, man. Ready to go? Yeah.
Yeah, hold on.
Let's get back right.
Up, you know, now that I'm standing, I gotta.
Not usual, but I'll follow you for this.
You know, I gotta make sure I don't let the suit wear you. Wear the suit. You know?
Hurry up. People are waiting.
Let's go.
I got things to do tonight. You have no idea what it means to us to support the incredible work happening at BMC's Center of Excellence in Sickle Cell Disease. As the largest sickle cell disease treatment center in New England, they are innovating care to improve the lives today and conducting cutting-edge research that will be an absolute game changer for people born with the disease in the future.
In the last 4 years, we've raised more than $750,000 for sickle cell treatment and research at BMC. With World Sickle Cell Day coming up this Saturday, now is the perfect moment to take that commitment to the next level.
Right now, we're launching a fundraising campaign for the McCourty twins Tackle Sickle Cell Endowment, a $6 million endowment to ensure BMC caregivers and researchers always have the funding they need to elevate their work to the next level and bring us closer to a cure.
You can join us and BMC caregivers who are working towards a sickle cell disease cure by donating now. If you've already made a donation, thank you. For those of you who haven't or want to make a second donation, please jump in right now. You can text in your pledge to the number on your screen or just click the donate button.
We've already asked nicely. This is my Bill Belichick. Donate now, donate again. Together, we're going to break down the walls to give new hope to BMC patients and people everywhere living with sickle cell disease.
While you're all finishing up your donations, it's time to finally reveal the work of art you've been seeing glimpses of all night.
Over the last couple weeks, Cedric Douglas, a Boston artist and designer, has been creating a new mural at Bartlett Station in Roxbury.
Bartlett Station will include 323 units of affordable and market rate housing. It will also have a supermarket requested by the community that BMC is supporting with a no interest loan.
This mural shows that where others see walls, BMC sees the potential to create change, inspiration, and a better future for Boston communities.
Now let's say it together, Dev.
Break down the wall! Break down the wall! Break down the wall! Wow. Man, that's awesome, Cedric.
Incredible.
Now let's hear from the artist himself, who has an incredible connection to BMC.
My name is Cedric Vice One Douglas, and my connection to Boston Medical Center is my grandmother actually worked there in the 1970s when it was called City Hospital. And she worked there for about, I think, 20 years. And coming from Jamaica to America, to Roxbury, and having that job for 20 years afforded her the opportunity to purchase her first home and to put a roof over the head for all her kids and to create equity within our family for generations to come. The craziest thing is I was actually born at Boston Medical Center myself. And, you know, thinking back, I remember my grandmother taking me and my younger brother to work when I was about 6 years old. And when she was doing her janitor work, she would go from room to room and the doctors would treat her like she was an equal. Not like she was a janitor, like an equal. And I think that's a testament of my grandmother and her work ethic and the type of person she was, but it's also a testament of the type of people in the Boston Medical Center community and how they interact with everyone at the hospital. My grandmother's story is special to me because she's my grandmother. But I think a lot of people from the community can identify with this same story because a lot of people are working hard trying to make, a better life for their family. And I think Boston Medical Center is providing these tools outside of the hospital walls so so people can have a better life for their family and reach their full potential. And this is what this mural represents for me.
Wow. Cedric, thank you. What an amazing piece of artwork for the community to enjoy. I'll have to swing by Bartlett Station in Roxbury and check it out before I head down to Miami.
Miami, you going on vacation to swim with the dolphins?
Dev, we'll talk about it later. Don't worry about it. Let's go.
Jason and I want to thank you all, viewers, sponsors, event co-chairs, and staff for joining us tonight and for your support of Boston Medical Center and our community.
And don't forget, there's still time to be a first-round supporter of the McCourty Twins Tackle Sickle Cell Endowment. Please make your donation now.
Say first round, I was a first rounder.
Not me.
It leads to championships,
Yes.
Trust me. We never realized until this past year how special it is to be able to connect with you all in person. And we're looking forward to seeing you at next year's BMC Gala and at our Tackle Sickle Cell event.
Good night.
Thank you, everyone. Hey, what is this Miami talk?
I'll tell you about it in September.
You going for a week?
No, I'll see you in September.